హలో ఆస్పిరెంట్స్, వెల్కమ్ టు ఫార్మసిస్ట్ యూట్యూబ్ ఛానల్. ఈ రోజు సెషన్లో మనం అటోనామిక్ నర్వస్ సిస్టమ్ ఎందుకు చాలా ఇంపార్టెంట్. అటోనామిక్ నర్వస్ సిస్టంలో ఉన్న బేసిక్స్ తెలుసుకోవడం వల్ల ఏ విధంగా మనం ఫార్మసీ కాంపిటేటివ్ ఎగ్జామ్స్ లో అటోనామిక్ నర్వస్ సిస్టమ్ సంబంధించిన డ్రగ్స్ అంటే సింపాథిక్ మీద యాక్ట్ చేసే డ్రగ్స్, పారాసింపాథిక్ మీద యాక్ట్ చేసే డ్రగ్స్, అలాగే సివిఎస్ మీద యాక్ట్ చేసే డ్రగ్స్ కూడా మనం కొంచెం క్లియర్ ఐడియా తెచ్చుకునే ఛాన్స్ ఉంటుంది. ఎస్పెషల్లీ చాలా మంది స్టూడెంట్స్ కూడా మన కమెంట్ బాక్స్ లో సో ఈ టాపిక్ గురించి మెన్షన్ చేయడం వల్ల నేను ఈ రోజు ఈ టాపిక్ డిస్కస్ చేస్తున్నాను. అండ్ ఫస్ట్ ఆఫ్ ఆల్ ఈ వీడియో వాచ్ చేస్తున్నందుకు చాలా థ్యాంక్ యూ సో మచ్. అండ్ డెఫినెట్ గా ముందుగా మన ఛానల్ అయితే సబ్స్క్రైబ్ చేసుకోండి. ఫార్మసీకి సంబంధించి థియరీ ఓరియంటేషన్ లోను, కాంపిటేటివ్ ఓరియంటేషన్ లోను, జాబ్ అలర్ట్స్ లోను అవేర్నెస్ సంబంధించి మీకు ఈ ఛానల్లో మీకు వీడియోస్ చేయడం అనేది జరుగుతుంది. అండ్ బిఫోర్ గోయింగ్ టు ద awareness, first we have to know about the glance of what is the classification of nervous system. What is the classification of a nervous system? Regarding the classification of nervous system, generally nervous system is mainly it is central nervous system, peripheral nervous system. Central nervous system as well as a peripheral nervous system. Wait a minute. Okay. Central nervous system and peripheral nervous system. Peripheral is again efferent division, sensory neurons, S for smart, and efferent division motor, M1. Again this efferent division is somatic system voluntary directly supplied to the skeletal muscle. Motor neuron directly supplied to the skeletal muscle and causes skeletal muscle contraction. And autonomic nervous system. Autonomic nervous system, again you know that there are three different types of autonomic nervous system. Sympathetic nervous system, also known as thoracolumbar region. Thoracolumbar region, from origin from the thoracolumbar region. And coming to the parasympathetic, from the craniosacral region. And other subdivision of autonomic nervous system is enteric nervous system. I think in most of the students may don't know that. I'm not decreasing you. So, so most of the students may be not aware in this. Enteric nervous system. Autonomic nervous system లో sympathetic ఉంటుంది, parasympathetic ఉంటుంది, అలాగే enteric nervous system. Enteric nervous system is mainly regulates the gastrointestinal tract activities, and enteric nervous system is known as a second blood-brain barrier of the body. Okay. Here, just have a how the sympathetic parasympathetic is organized. Sympathetic nervous system అనేది thoracolumbar region నుంచి ఆరిజినేట్ అవుతుంది. thoracic vertebrae, lumbar vertebrae. Parasympathetic చూసుకుంటే కనుక you can remember like this: parasympathetic from the craniosacral. PCS, P means parasympathetic, C means cranial, S means sacral. And sympathetic nervous system from the STL. S means sympathetic, T means thoraco, L means lumbar. And generally, the sympathetic is catabolic in nature. Involves in the expenditure of energy. Coming to the parasympathetic, it is anabolic in nature. It stores the energy. And especially the sympathetic involves in E activities like exercise, excitement, embarrassment. Exercise. During the exercise, sweating will be happening. Sweating is under the regulation of sympathetic nervous system. And especially parasympathetic under the control of D activities like digestion, defecation, diuresis. And regarding the further points, further continuation, sympathetic having wide distribution throughout the body compared to the parasympathetic having less distribution. And especially the ganglia are away from the organs. Ganglia are distance from the organs, away from the organs. Coming to the Coming to the parasympathetic, organs are close to the organs. So here, adrenaline, noradrenaline, and dopamine is also a neurotransmitter in the sympathetic nervous system. But here, in case of parasympathetic, one and only neurotransmitter is acetylcholine. Sometimes there is an involvement of nitric oxide based on requirement, especially when M3 receptors, type 3 muscarinic receptors are activated on blood vessels, release of nitric oxide. Nitric oxide is a potent vasodilator. Okay, and the important function of sympathetic is the important function of sympathetic tackling the stress and helps in the emergency condition. Tackling the stress as well as helps in the emergency condition. When coming to parasympathetic nervous system, involves in assimilation of food and conservation of energy. So parasympathetic stores the energy, sympathetic expend the energy, expenditure of energy. And sympathetic nervous system also known as flight or fight response. Parasympathetic is known as rest and digestive activities. Rest and digestive activities. Next, so this is very very important and this is very essential to understand the classification of sympathomimetics, sympatholytics, parasympathomimetics, neuromuscular blockers as well as ganglionic blockers. So simply, so this is before slide how the sympathetic parasympathetic structurally organized. సో అంటే స్ట్రక్చరల్ గా ఏ విధంగా ఆర్గనైజ్ ఉన్నది ఇక్కడ మనం చూసుకుంటే కనుక సింపాథెటిక్ పారాసింపాథిక్ రెండు కూడా ఏ విధంగా ఫంక్షన్స్ అనేవి పర్ఫామ్ చేస్తాయి సో సింపాథిక్ పారాసింపాథిక్ రెండు కూడా ఆపోజిట్ గా వర్క్ చేస్తాయి సో సో దట్ సైడ్ parasympathetic and here it is the sympathetic here it is the sympathetic so regarding parasympathetic it causes constriction of pupil of eye causes meiosis constriction of pupil of eye meiosis. And when coming to sympathetic, it causes dilation of pupil of eye, mydriasis. So mydriasis containing letter D, and dilation of pupil starts with letter D. So sympathetic causes mydriasis, dilation of pupil of eye. Parasympathetic causes constriction of pupil of eye. And on salivary glands, parasympathetic increases salivary secretions. So parasympathetic nervous system by muscarinic receptor, stimulation of all secretions from all glands. And coming to the sympathetic, it inhibits the salivation. And coming to the parasympathetic on heart, acetylcholine decrease the heart rate. Acetylcholine decreases the force of contraction, decreases number of beats, decreases conduction velocity, decrease the cardiac output, decrease the blood pressure by relaxing the cardiac muscle. So sympathetic nervous system causes contraction of cardiac muscle and positive inotropic, increase force of contraction. Positive chronotropic, increase number of heartbeats. Positive bromotropic, increase the conduction velocity of heart. Increase the conduction velocity of the heart. Next. So, on lungs, parasympathetic causes constriction. Constriction of contraction of bronchial smooth muscle and increase the bronchial secretions. And on lungs, the sympathetic causes dilation of bronchial smooth muscle, decrease the bronchial secretion, decrease the bronchial secretion. And on the stomach, parasympathetic increase the gastrointestinal movement and increase the secretions from the gastric region and helps in digestion. Especially sympathetic decrease the gastrointestinal tract movements, GIT movements, and excess sympathetic activity on GIT may produce constipation. And liver, on the liver, parasympathetic stimulate the gallbladder and increase the bile secretion, bile production. So sympathetic having inhibitory effect on the gallbladder. On the intestine, sympathetic increase the gastric movement, sorry, increase the intestinal movements. The that is parasympathetic. So parasympathetic on intestine increase the intestinal movements, and sympathetic is inhibit the activity of intestine. That is dilation of the intestinal smooth muscle. So on the urinary bladder, parasympathetic causes contraction of urinary bladder and increase the urination. And sympathetic relax the bladder, decrease the urination by promoting ADH function, antidiuretic hormone. ADH name itself indicating it opposes the urination. It opposes the urination. So this is simply about the basic level approach of autonomic nervous system. And based on this, we can easily understand So what is the pharmacology of autonomic nervous system, and you can also get some idea in cardiovascular pharmacology also. Okay, so what is simply introduction to central nervous system? So what is the classification of autonomic nervous system? So what is the structural organization of sympathetic parasympathetic? And what is the functional organization of sympathetic parasympathetic? For example, parasympathomimetics on eye, treatment of glaucoma, and sympathomimetics on eye causes mydriasis, dilation of pupil of eye. So like this, so first you have to know the different functions of sympathetic, parasympathetic along with receptors, along with the receptors. So this is simply about a discussion regarding the basic approach of autonomic nervous system and sympathetic nervous system versus parasympathetic nervous system functions. Okay, thank you. Subscribe to Pharma Syndrome YouTube channel like more videos.